Assalamu alaikum warahmatullahi wabarakatuh. To carry on with the upper limb lectures, I'm going to cover in this presentation the anatomy of the ulnar nerve. I'm Dr. Dalia Saleh, professor and the head of anatomy department at Mansoura University, Egypt. The objectives of my presentation are: first, I'm going to talk about the origin of the ulnar nerve, its course, inside the axilla, the arm, the cubital fossa, the forearm, and inside the hand. And then I'm going to talk about its branches, either cutaneous, muscular, or articular, and finally about its injury. The ulnar nerve is the largest branch of the medial cord of the brachial plexus, so it carries the fibers from C8 and T1. It lies medial to the third part of the axillary artery in the axilla and carry on the medial side of the brachial artery within the arm. At the level of the coracobrachialis insertion, it pierces the medial intermuscular septum to get into the back of the arm, accompanied by the superior ulnar collateral artery. Then it leaves the arm behind the medial epicondyle of the humerus, and this is known to be a dangerous position for the ulnar nerve. It enters the forearm between the two heads of the flexor carpi ulnaris muscle, and then descends on the anteromedial aspect of the flexor tutorum profundus between it and the flexor carpi ulnaris. It enters the hand in front of the flexor retinaculum, but covered by a fascial sling. Then it passes between the hook of hamate and the pisiform bone, and then divides into superficial and deep branches. Along its course, it has no branches in the axilla or in the arm or in the cubital fossa, but in the forearm it starts to give its muscular branches and articular branches, and also gives dorsal cutaneous and palmar cutaneous branches. Then, when it enters the hand, it gives a superficial branch. It has muscular and cutaneous components, and then a deep branch which is muscular to the short muscles of the hand and also articular to the small joints of the hand as well. In the forearm, it supplies the flexor carpi ulnaris and the medial half of the flexor digitorum profundus, or the part of the muscle that supplies or flexes the ring and the little fingers. In the hand, it gives a superficial branch that supplies one muscle called palmaris brevis muscle, found at the hypothenar eminence, while its deep branch supplies the short muscles of the hand, or most of the short muscles of the hand, like the hypothenar eminence muscle, namely the flexor digiti minimi, the abductor digiti minimi, and the opponent's digiti minimi. Also, it gives branches to the medial two lambricals and to the adductor pollicis and to all interossei, dorsal interossei, and the palmar interossei. Its cutaneous branches as follows. The palmar cutaneous branch supplies the medial third of the palm of the hand, while the palmar digital branches supplies the palmar aspect of the medial 1½ fingers, while its dorsal cutaneous branch supplies the medial third of the dorsum of the hand as well as the dorsal surface of the medial 1½ fingers. Regarding its nerve lesion, the ulnar nerve could be compressed or injured at any point of its course. The commonest sites for its injury at the elbow joint, where it passes behind the medial epicondyle, so it can be crushed there, or at the wrist under this fascial sling that could compress it against the flexor retinaculum. The manifestations of its nerve injury include deformity, known as claw hand, motor loss, and sensory loss. The claw hand deformity is characterized by the following. The ring and the little fingers are flexed. There is hyperextension of the metacarpophalangeal joints and flexion of the interphalangeal joints of the ring and little fingers. There is atrophy of the dorsal interosseous spaces and also atrophy at the hypothenar eminence. Also, the patient cannot adduct his thumb. If it is combined with the median nerve injury, this will result in complete claw hand. If the injury of the nerve is at the elbow joint, this will lead to affection of all of its branches, and the motor loss will be as follows. The muscles at the forearm will be paralyzed, like the flexor curvi ulnaris and the medial half of the flexor digitorum profundus. This will lead to weakness of flexion of the wrist, and also the patient cannot adduct his wrist, and this will lead to radial deviation of the hand. For the muscles of the hand, the interossei and the medial two lambricals will be paralyzed, so there will be weakness of adduction and abduction of the fingers due to paralysis of the palmar and dorsal interossei. Also, there will be extension of the metacarbophalangeal joints and flexion of the interphalangeal joints of the ring and the little fingers due to paralysis of the medial two lambricals. And as a result of paralysis of the adductor pollicis, the patient can no longer adduct his thumb. For the sensory loss, there will be loss of all sensation from the palmar and dorsal aspects of the medial third of the hand and the medial 1½ fingers due to affection of the palmar cutaneous branch, the palmar digital branch, and the dorsal cutaneous branches. If the lesion is at the wrist joint, then the character of the motor loss will be as follows. There will be sparing of the muscles of the front of the forearm, and the muscles of the hand will be affected. So, the deformity is severe. We call it the ulnar paradox. What's meant here by ulnar paradox is that the flexion at the little and ring fingers will be more obvious due to sparing of the medial half of the flexor digitorum profundus, and thus the patient can flex his ring and little finger more. Again, if the lesion is at the wrist, then the dorsal and the palmar cutaneous branches are not affected, so the sensory loss will be as follows. The area of distribution of the palmar cutaneous nerve will be spared, and also the area of distribution of the dorsal cutaneous nerve will be spared. And the only area affected is that area supplied by the palmar digital branches, so there will be loss of sensation over the palmar surface of the medial 1½ fingers only. This is the end of my presentation. Thanks for listening. If you like it, please do not forget to subscribe, like, and share, and do not forget to hit the notification bell so you can know if I upload another video.